Good evening, everybody. We have our Monday Night Live with myself, Nurse Jackie, and tonight we'll be going over exercise and activity practice tests for CNAs and patient care technicians. So exercise and activity are introduction. Exercise and activities of daily living benefit patients by improving their physical and mental well-being. As a CNA, helping patients move safely and regularly can prevent complications such as bed sores, muscle weakness, and depression. In this practice test, you'll reveal essential CNA knowledge and skills related to promoting patient mobility and independence through proper exercise and activity support. I'm starting to see people come through in the comment section. Good evening, everyone. Thank you for joining me. So let's get started. Now that you understand the importance of exercise and activities of daily living, it's time to test your knowledge. So grab a pen, paper to write down your answers. And you guys have this. You guys are all so smart. And don't forget to like, share, and subscribe for more CNA and PCT practice tests. You guys can also visit the website at www.fltraining.com for study guides, classes, and more. So I'll give you guys a few seconds to grab everything that you need, and we'll go ahead and get started. Hello, everyone. I see returning people in the comment section. I see Jennifer, Augusta, Elaine, Sherry, Michelle, some other familiar names, Naomi, Danita, Jesus, Bonita. And if I don't recognize your name in the chat, if you're new here, thank you for joining in. So let's go ahead and get started. So question number 1, which of the following is considered an instrumental activity of daily living? A, bathing, B, brushing teeth, C, cooking a meal, or D, toileting? I'll give you guys about 5 seconds. Here we go in 3, 2, and 1. The correct answer there was C. IADLs include tasks that allow a person to live independently, such as preparing meals, managing money, or using a telephone. Now we're on to question 2. Question 2 says, which of the following is a passive range of motion exercise? A, the CNA gently moves the resident's limb. B, the resident lifts their own arm. C, the resident runs on a treadmill. Or D, the resident performs stretches in bed without help. All right, we'll reveal the answer in 3, 2, and 1. The correct answer is, let's see, I think it slipped on me. Hold on. There we go. The correct answer is A. Sorry about that. My computer froze. Passive range of motion means that the movement is done by the caregiver without the patient using their muscle. So if something's passive, then the caregiver is doing it for them. So remember that passive means that the caregiver is doing it for them. Good job in the comment section, you guys. Question 3. A patient has been on bed rest for several days. What condition can regular exercise help prevent? So remember to look and see what the question is asking, and then look through all your answer choices to make sure that you are picking the best answer here. So A is tachypnea, B is edema, C is muscular dystrophy, or D, atrophy. I'll give you guys about 5 seconds here to answer. And just so you guys know, tonight we will be doing 30 questions. So 30 will be the total. And if you guys don't know the answer, it will not hurt for you guys to guess at an answer. So if you don't know, never skip an answer, always guess. We'll reveal the answer in 3, 2, and 1. The correct answer is D. Great job in the comment section. Atrophy is weakening or shrinking of the muscles due to lack of use. Common in patients on bed rest. Regular movement and exercise help maintain muscle tone and prevent atrophy. Muscular dystrophy is a genetic disorder that causes progressive muscle weakness over time. It cannot be prevented with exercise. Question number 4. What is the proper way to position a resident in Fowler's position? A is lying flat. B, the foot of the bed elevated 15 to 30 degrees. C, head of the bed elevated to 45 to 60 degrees. Or D, knees to chest. Give you guys a few more seconds here. And 3, 2, and 1. The correct answer is C, Fowler's position, which improves breathing and is ideal for eating or respiratory treatment. So whenever you have a patient who is eating, you want to make sure that they're in an upright position. And then with respiratory treatments, we want them to be in an upright position too, because this allows the lungs to expand. Question number 5. A CNA is assigned to help a resident with active range of motion. This means the resident A is unconscious, B can move their joints independently with some guidance, C needs full assistance with moving, or D should remain in bed. Give you guys about 3 more seconds here to answer that one. And 3, 2, and 1. The correct answer there is B. A lot of correct answers there. Good job, you guys. So active range of motion involves movement performed by the patient with encouragement from the caregiver. So the difference between active and passive, they're two different things. So active range of motion means that the patient is doing. So you can remember active, like if you are being active when working out, you yourself are doing it. And then passive range of motion is whenever the caregiver is doing it. So you guys want to make sure you can differentiate between active and passive. I know whenever I was a CNA instructor, that was a question on their test. So the difference between active range of motion and passive range of motion, be sure to know the difference. All right, question 6. Which ADL should a CNA encourage a patient to perform as independently as possible? A, administering medications, B, making phone calls, C, dressing, or D, managing finances. All right, I'll reveal this answer in 3, 2, and 1. The correct answer there is C. Dressing is a basic ADL, and CNAs promote independence by assisting only when needed, encouraging patients to do as much as they can for themselves. So you guys, that's called fostering independence. So we want to foster independence, allow the patient to do as much as they can for themselves for as long as they can, because I know you guys know the saying, if you don't use it, you lose it, which is very true. So even if it takes them longer to do it, we want to make sure that we're fostering independence and allowing them the time to get things done. Question number 7. What is the purpose of a trochanter roll? A, to prevent external rotation of the hip. B, to prevent internal rotation of the hip. C, to support the neck. Or D, support the patient or to prevent the patient from crossing their arms. Give you guys a few seconds to answer this one. Now, one thing I like about how this question is written, because question or selection A and B are very similar. So it's always important to remember to read your question thoroughly, because in your head you may think, oh, for sure it's A, and then you may select B when you're reading it quickly because you think they look so similar. So be careful. be careful and slow down and make sure that you're selecting what you believe is right. I'll reveal the answer in 3, 2, and 1. The correct answer is A. So trochanter rolls are used to keep the hips in proper alignment, especially for immobile patients. So in the picture to the right, it shows the trochanter roll preventing the legs from turning outward. So it keeps it tight so that they're unable to. It's not too tight though, but it's to prevent that outward motion. Question number 8. What should a CNA monitor for during a patient's exercise session? A, their level of education. B, respiratory rate and fatigue. C, rehab potential. Or D, their favorite hobbies. All right, in 3, 2, and 1. Correct answer is B. Excellent job, you guys. So during exercise, CNAs must watch for signs of overexertion, like fast breathing, which is the other name for that is tachypnea, dizziness, or tiredness. Monitoring respiratory rate and fatigue ensures that the patient is exercising safely and not pushing beyond their limits. Rehab potential is typically assessed by a physical therapist, not a CNA. Question number 9. A patient has slight balance issues but can walk independently. Which DME is most appropriate? A, the wheelchair. B, walker. C, crutches. Or D, cane. So another thing to know, you guys, is your terminology, because if you don't know what DME is, here you may be a little lost. So it's important that you learn that terminology so you can answer your questions properly. And if you don't know, take your best guess and we'll reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is D. Great job. A cane provides minimal support and is best for patients with mild balance problems who can still walk independently. Can somebody in the comment section tell me what DME stands for? We'll wait a few seconds here. I know you guys know it because a lot of you guys got that answer correct. So let's see what we have. I'm just watching the comment section, waiting on one of you smart people to give me the correct answer. Medical devices. And what is DME? It is a medical device, but tell me what DME stands for. Durable medical equipment. Good job, both of you guys. Benita, Tori, you guys got it. Benita, you were definitely following the correct lines. Great job, you guys. And then you can be able to break that down. So durable medical equipment. Excellent job. So some things that you may see is like a walker, a cane. It's and they usually have these at the pharmacy. So I used to work on the rehab unit, and the patient would have a prescription when they got discharged for DME for a walker or DME for a cane, and they would take that to the pharmacy so that they could get their medical equipment. So excellent job, you guys. Excellent critical thinking there. Keep it up. Question number 10. A care plan states that the patient requires moderate support and tires easily while walking. Which is best? A, standard walker. B, crutches. C, a gait belt. Or D, a cane. So they need moderate support. Right, we'll reveal the answer in 3, 2, and 1. Great job, you guys. The correct answer is A. A walker offers more stability than a cane and is more appropriate for patients needing moderate support during ambulation. You guys, what does ambulation mean? Somebody in the comment section tell me what ambulation means. So if I say I'm ambulatory, I'm ambulating, somebody says something is for ambulation, that's all similar. They're referring to the same thing. What does that mean? Walking. Good job, Tori. Excellent job, you guys. Thank you very much for participating, Tori and Chrissy and Miss Bonita. Excellent job, you guys. Thank you. And Naomi and Tenzin. You guys are all in there with it. Jennifer, Mercy, Sherry, Augusta. Yes, excellent job, guys. Hello. Hello. All right, here we go. Let's keep going. Question 11. Before helping a resident walk, what should the CNA do first? A, wash your hands. B, ask another resident for help. C, tell them to get up slowly on their own. Or D, check the resident's care plan and activity order. My smart friends in the comment section. Look at you guys. I'm so proud of you guys. All right, here we go in 3, 2, and 1. The correct answer is D. Always check the care plan to ensure that the resident is allowed to ambulate and with what level of assistance. So sometimes you may have a patient say, hey, come and get me up. And then you ask like, are you supposed to be up with 1 or 2? But if you check your care plan prior to that, you would know, because what if your patient is confused? Or what if they just don't want to wait on somebody else to come and they just say, oh, I'm up with 1 person. Meanwhile, they may have to get up with the Hoyer lift. So always be sure to check that plan of care or your care plan to make sure you have the proper equipment. Question 12. Which action helps promote circulation in a bedbound resident? A, placing several pillows under their arms. B, turning them once a day. C, performing leg exercises or repositioning every 2 hours. Or D, keeping them in high Fowler's position all day. Give you guys about 5 seconds on this one. All right, in 3, 2, and 1. The correct answer is C. Frequent position changes in activity encourage blood flow and help prevent clots. Question number 13. A male patient recently had a stroke and now has left-sided weakness. His wife brought in his favorite cane from home. What should the CNA do first? A, let the patient use the cane immediately to make him feel comfortable. B, nicely ask her to take the cane home. C, check with the nurse or care plan before allowing the cane to be used. Or D, assist the patient to walk with the cane. Give you guys 5 seconds here. So always remember to select the best answer. Some answers might sound good, but we also always want to pick the best answer. All right, in 5, 4, 3, 2, and 1. The correct answer is C. Safety comes first. The CNA must follow the care plan or get the nurse's approval to ensure that the cane is safe and appropriate for stroke recovery. So we want to make sure some things that you may notice, like whenever I worked in rehab, the PT and the OT, so the occupational therapist, physical therapist, they will all make sure that the patient had the proper equipment. So some things that they would take into account would be like how tall the patient is for the canes, because you want it at a certain level. If the cane's too short or if it's too tall for the person, then it wouldn't be appropriate for them. Question 14. Which of the following devices help prevent foot drop? A bed cradle, B, a footboard, C, a triangular pillow, or D, a hip abduction pillow. Give you guys about 5 seconds here. And 5, 4, 3, 2, and 1. The correct answer there is B. Footboards keep the feet in proper alignment and prevent contractures like foot drop. Good job there. Question 15. Which action by a CNA promotes a resident's independence during activity? A. Performing all their movements for them. B. Ignoring requests to move. C. Rushing them to finish their exercises. Or D. Encouraging the resident to do what they can safely. I'll reveal the answer in 5, 4, 3, 2, and 1. The correct answer is D. Supporting independence improves confidence and maintains strength. So there again, we want to foster independence. So if you guys haven't done so already, be sure that you like, share, and subscribe. And then you can also go to the website at www.fltraining.com. All right, question 16. A patient who is post-stroke has aphasia and cannot express when they feel tired during ambulation. What should the CNA watch for? A, eye color changes. B, lack of interest in therapy. C, increased talking. Or D, shortness of breath, sweating, or unsteady steps. All right, starting to see the comment section fill up a little bit. All right, in 3, 2, and 1. Correct answer is D. Good job, you guys. Nonverbal signs of fatigue and distress are key observations when patients have communication deficits like aphasia. Be sure to observe for nonverbal signs and cues. So I need somebody to help me out in the comment section again. What does aphasia mean? I'm looking, I'm watching and waiting. I know you guys know this. Difficulty talking. So difficulty talking would be dysphagia. Remember, because our prefix dys means difficulty. What is not being able to talk? That's aphasia. Yes, good job, you guys. That was a tough one, but those are two different words. So remember, our prefix dys means difficulty, and then our prefix a means without. So if they're aphasic, that means that they cannot speak. If they have dysphagia, that means they have difficulty speaking. So excellent job there, you guys. All right. Question 17. What should the CNA do if a resident complains of pain during range of motion? A, reassure the resident that some discomfort is normal and continue with the exercise slowly. B, stop the movement immediately, document the observation, and report pain to the nurse. C, attempt the same motion on the opposite side to compare with the resident's reaction. Or D, proceed with the range of motion exercises on other joints without reporting. All right, we'll reveal this answer in 3, 2, and 1. Correct answer is B. This is the safest and most appropriate action. The CNA's role include observing, reporting, not diagnosing, or treating. Pain is a significant finding that must be reported. Pain is always subjective, so be sure to listen to your patient. I have another one for you guys. So in the comment section, somebody tell me what subjective means. If something is subjective, what does that mean? Because I want you guys to be able to understand these rationales so that you can apply them in the future. So I'll give you guys a hint. Sometimes they ask for subjective or objective data. So they give something to compare it against. But I want to know if something is subjective, what does that mean? You cannot see the signs, but what can you do? Yes. So you guys all got it correct. So all of our brains think a little different, and that's fine. But subjective is something you cannot see, but it's what the patient says. So the way that I remember it, because I just put things together kind of different so I can remember it in my head. Subjective is what they say. So S and S, subjective say. If it's objective, it's like I think of like an object. It doesn't have to necessarily be an object, but that's how I compare the difference. Subjective is saying. So if I look at you and I'm smiling and I say, my pain is a 10, even though I'm smiling, that doesn't mean that I'm not having a lot of pain. That may be a way that I'm dealing with my pain. So if I say that my pain is a 10, it could be a 10, but most of the time those symptoms all go in together. Like I may be saying, oh, my pain is a 10 and I'm guarding, I'm hurting my abdomen or holding my abdomen. But you may see a patient say, my pain is at a 10, and they may be smiling, but they're grimacing. And you might be like, well, they're laughing. How is their pain a 10? What the patient says their pain is, that's what we report, and that's what we tell the nurse, okay? All right, great job, you guys, in the comment section. So be sure you guys know what subjective and objective data is. And I can tell you guys on a state board exam for a CNA, I have had students have this question before, something about doing range of motion, and they have to stop if they're doing range of motion and the patient reports pain. So be sure that you guys take that away from tonight's live stream. All right, here we go. Question 18. During morning care, a CNA is assisting a resident recovering from a stroke with range of motion exercises. The CNA gently supports the arm to help complete the motion due to the resident showing signs of weakness. Which type of range of motion is being performed in this scenario? A, active range of motion. B, passive range of motion. C, active assisted range of motion. Or D, resistive range of motion. Give you guys about 5 seconds to answer that. All right, in 3, 2, and 1, we are revealing the answer. The correct answer is C. So that was a tough one too. This one is active assistive range of motion. So it's a type of motion exercise used in rehab and patient care that involves both the patient and the caregiver. This is common during rehab or recovery when strength is limited, but some mobility is present. So that's another thing, you guys know your different types of range of motion, because I've seen those types of questions on the state exam as well. Question number 19. The resident who recently has left-sided weakness has been prescribed a cane. The resident asks, which hand should I hold the cane in? What is the most appropriate response? A, hold the cane in your left hand since that side is weaker and needs more support. B, use your right hand so the cane supports your weaker side during walking. C, it doesn't matter which side you use. Or D, hold the cane behind your left leg when stepping. I'll give you guys about 5 seconds to answer this question. This is a loaded question, I feel like, but I feel like this is an excellent question as well. So think this one through. I'll give you guys 5 more seconds in 5, 4, 3, 2, and 1. The correct answer is B. The cane should be held on the stronger side, which would be the right hand, because in this case, the patient had left-sided weakness, to help shift weight away from the weaker leg, promoting a safer and more balanced walking pattern. So always remember that the assistive device was going to go on the stronger side. Great job, you guys. Question number 20. The resident face appears pale during ambulation. They're holding onto the walker with more difficulty than before. What is the best course of action for the CNA to take at this moment? So you guys, another thing that I do, and it helped me whenever I answer my questions, I think about these things in my head. So as I'm reading this, I'm picturing all these things going on. And I'm thinking, okay, what would I do next? As a CNA, what's my role? What am I going to do next? So A, remind them that they need to push through the fatigue. B, gently push the resident to help them complete the walk and reach the end of the hallway. C, offer the resident a seat on a nearby chair, assess their vital signs, and monitor their tolerance to the activity. Or D, let the resident finish to walk on their own. I'm seeing a lot of comments already, so I'll give you guys about 3 seconds to finish that. In 3, 2, and 1. Correct answer is C. Excellent job. Offering a seat and assessing the situation allows the CNA to safely monitor the resident's condition, ensuring that they aren't overexerting themselves and avoid potential complications related to the resident's cardiovascular disease. Let's see here. Albert, I'm reading in the comments. Thank you so much. This platform has really helped. I passed the CNA last Wednesday. Congratulations, Albert. We are so proud of you. Everybody here is proud of you, and thank you so much for still attending. We really appreciate that. All right, question 21. A nursing assistant is assigned to check orthostatic vital blood pressures for a patient with a history of dizziness upon standing. The patient's blood pressure is 130/80 while laying down, 118/78 while sitting, and 98/64 while standing. Which of the following actions is the most appropriate based on these findings? Option A, encourage the patient to increase fluid intake and document the readings. Option B, record the standing blood pressure only as it reflects the orthostatic value. C, repeat the blood pressure after 15 minutes to verify the accuracy. Or D, assist the patient back to bed, notify the nurse, and document all the readings. You guys are so friendly. I appreciate you guys congratulating him as well. It means a lot. All right, give you guys 5 seconds. In 5, 4, 3, 2, and 1. The correct answer is D. So the correct action is to assist the patient back to bed, notify the nurse, and document all the readings. A drop in systolic pressure of 20 or more and 10 in diastolic pressure indicates orthostatic hypotension, which increases the risk of falls. Patient safety comes first, and abnormal findings must be reported. So you guys know with the blood pressure reading, the top number is your systolic number. The bottom number is your diastolic number. 20 in the top number or more, and or 10 in the bottom number. That indicates that the patient has orthostatic hypotension. So some symptoms that you may see with that, your patient may feel more dizzy whenever they're first getting up. So if they have orthostatic hypotension, we want to make sure, as we do with everyone, but we want to make sure that they're rising slowly, because we don't want that blood pressure to drop and then they bottom out and then they end up falling because they're moving too quickly. So that's just something to be mindful of. Question number 22. Which of the following exercises promotes deep breathing? A, arm raises and shoulder rolls. Is anybody doing shoulder rolls right now? Because I am. I'm just thinking about it. B, jumping. C, ankle circles. Or D, finger tapping. All right, I'll give you guys about 5 seconds to answer that. In 5, 4, 3, 2, and 1. The correct answer is A. Exercising involving chest and upper body movement. Oh, I have to sneeze. It won't. Give me just 1 second. Excuse me, guys. Allergy season is upon us. I have bad seasonal allergies, so excuse me and sorry for that. Exercises, including chest and upper body movement, help expand the lungs. Arm raises and shoulder rolls are particularly effective for individuals with respiratory conditions like COPD. They promote full expansion of the lungs and can help reduce feelings of breathlessness. So, COPD is chronic obstructive pulmonary disease, so it's a lung disease. Question 23. A home health aide notices that a diabetic patient prefers to walk around the house wearing flip-flops. What is the best response by the aide? A. Allow the patient to continue if the flip-flops are comfortable. B. Advise the patient to wear flip-flops only indoors. C. Inform the patient that footwear is a personal choice and should not be interfered with. Or D. Encourage the patient to wear closed-toe, non-skid shoes to protect their feet. All right, we'll reveal the answer in 3 seconds. So 3, 2, and 1. The correct answer is D. Proper footwear reduces the risk of slipping and falling. Shoes that provide non-skid soles are critical to reduce the risk of slipping. A secure fit ensures that the shoes won't cause discomfort or allow the resident to trip over loose footwear. This combination of features promotes both safety and comfort for the resident. So proper footwear is very important. We shouldn't be walking our patients with bare feet. We always want to make sure that they have on proper footwear because we know fall prevention is key. We don't want people sustaining falls. Question 24. A resident on bed rest is encouraged to perform leg exercises regularly. What is the primary reason for this recommendation? A. To promote blood circulation and to prevent clots. B. To strengthen upper body muscles. C. Improve digestion. Or D. To reduce the need for physical therapy. Good job, you guys. I'll reveal the answer in 5 seconds. So 5, 4, 3, 2, and 1. The correct answer is A. Excellent job there. Leg exercises help prevent venous stasis and reduce the risk of DVT, also known as deep vein thrombosis, which is a common complication for immobile patients. So we want to keep those legs moving. Question 25. Which of the following is a benefit of daily activity for residents? A. Lower blood pressure. B. Reduce hydration. C. Improve strength and mobility. Or D. Increase dependence. Or we have an option E on this one, which is A and C. Give you guys about 5 seconds to answer that. In 5, 4, 3, 2, and 1. The correct answer is E. Excellent job there. Regular activity improves cardiovascular health, which can lead to lower blood pressure, and it strengthens muscles and joints, enhancing mobility. And these benefits help residents maintain independence and quality of life. Question number 26. When using a mechanical lift, also known as a Hoyer, to transfer a patient, which of the following steps is most important? A. If the patient is able to transfer with assistance, only one trained staff member is needed. B. Always use at least 2 trained staff members. C. Place the lift on the patient's weaker side. Or D. Ask the patient to control the lift remote. Guys, about 5 seconds to answer that. In 5, 4, 3, 2, and the correct answer is B. Safety guidelines for mechanical lift recommend 2 staff members to prevent injury from both to the caregiver and the patient. So as you guys can see in this photo, there's 2 staff members there. One of them is guiding the patient and the other is guiding the machine. So it's important whenever you have your Hoyer lift or your mechanical lift that you're using 2 people to assist with that, because we do not want to cause injury to the patient. And this is also a scary time for the patient being up in the lift. One experience that I got to have whenever I was going through my CNA program, they actually had us get into the lift so we could know what it would feel like. And it's definitely like you're in the hands of other people. You really have not much control for that. So be sure that you're being mindful of that and that you're doing safe practices for your patient. Question 27. Which of the following best describes flexion? A, straightening a joint. B, rotating a limb outward. C, bending a joint to decrease the angle. Or D, moving a limb away from the body. This is another one of my favorite questions. Give you guys about 5 seconds for this one. In 5, 4, 3, 2, and 1. The correct answer here is C. Flexion is the act of bending a joint, such as bringing the hand toward the shoulder, decreasing the joint angle. So, for example, if I'm doing flexion exercises, I could be doing like this in sets of 10. So I'm bending my joint, bringing my hand towards my shoulder, and bringing it back out. So I'm bringing it in. This is the flexion. And then when I bring it out, you guys, what is this called? Bonus point here. So this is flexion here, bringing it in, the hand towards the shoulder. I'm decreasing the joint angle because this is my joint here. If I bring it out, what is that called? It starts with an E. And I know you guys know this because you guys are very smart. And I'm waiting. So we have our flexion. Yes, Chrissy. Extension. Excellent job there. So you guys, that's another important thing to know. Your flexion, your extension, and your different activities that you'll be doing with the range of motion. So flexion, extension. Excellent job there. Chrissy, Renee, Tori, Miss Benita. I really appreciate this interactions that you guys are doing. So thank you so very much. And Miss May, I see you there too. Thank you guys. All right, question 28. Love this one too. I don't know why. This is just one of my favorite things to learn. Nellie, thank you as well. I see you in the comment section. So what does abduction mean when performing a range of motion exercise? A, moving a limb away from the body. B, moving a limb toward the body. C, raising the arm above the head. Or D, turning the foot inward. And again, when I used to take my test, I would be doing these things. I wouldn't make it really noticeable, but like if I was doing A, I would kind of move away. B, I'd move it towards. C, like I'll do one of these numbers. I think I'm more of a hands-on learner though, so whenever I'm learning things, I have to actually do them to learn them. I'll give you guys about 5 seconds there. In 5, 4, 3, 2, and 1. The correct answer is A. Excellent job there. Abduction means away. It's the movement of a limb away from the body center line, like lifting the arm out to the side. So as you can see, whenever you're making a snow angel and your arms are up and out like that, that's abduction. So, if someone is abducted, they're taken away. So think of it like that, away. You guys, what is the opposite of abduction? So in the comment section, we already talked about flexion, which is this. We talked about extension, which is here. we're talking about abduction. So we're taking away from the midline. And what's, yes, good job, Tori and Chrissy and Naomi. Excellent job, you guys. So adduction is when you're going towards the midline. So the way that I remember the difference between abduction is away. So someone's taken away. Adduction means you're adding to the body. So, in an addition sentence, you're adding to. So add means plus to me. That's the way that I think of it in my head. Great job, you guys. Thank you, Jennifer and Chrissy and Renee and Miss Benita and Tori, all you all commenting there. Excellent job. Question 29. A post-op hip replacement patient is using an abduction pillow. What is the primary purpose of this device? A, to increase hip flexibility. B, to help the patient sleep more comfortably. C, to keep the legs separated and prevent dislocation. Or D, to reduce swelling in the lower extremities. Give you guys about 5 more seconds to answer this. In 5, 4, 3, 2, and 1. The correct answer is C. So after hip surgery, an abduction pillow keeps the legs apart and the hip in proper alignment to prevent dislocation during healing. So after the patient has a hip surgery, you'll see they'll be on hip precautions. So some other things you may see, they're not supposed to cross over their legs because that could cause joint dislocation. We don't want them bending at the hip more than 90 degrees because that can cause joint dislocation. So there's a lot of things that you may see for a patient if they have hip precautions after they've had a hip surgery, because we want that to stay in alignment so that it doesn't become dislocated, which can be very painful to the patient and may cause them to have surgery again if it does get dislocated. So make sure we are doing our hip precautions. Question number 30. Which of the following best defines bed mobility as assessed in a patient care setting? A, the capacity to operate or transfer into a wheelchair without assistance. B, the act of ambulating short distances such as walking to the restroom without assistance. C, performing activities such as feeding or grooming while positioned in the bed. Or D, the patient's ability to independently change body position or reposition themselves while laying in the bed. Give you guys about 5 seconds to answer that. 5, 4, 3, 2, and 1. The correct answer is D. Bed mobility refers specifically to a patient's ability to move and reposition within the bed, including turning side to side, scooting up and down, or adjusting limbs without necessarily leaving the bed. So good job there. So that is all of our questions for tonight, you all. This is a beautiful picture here. It says caring CNAs become curing nurses, which is very true. You guys, compassion and caring will take you a long way in this field. And you guys know we need it now more than ever, and we always have. But every day we should always be kind and compassionate to everyone. And thank you guys so much for watching. Be sure to comment, like, share, and subscribe. I'm going to take my photo off of here so you guys can see the website. It's www.fltraining.com. And then thank you guys so much for watching. I'm in the comment section reading all you guys' comments. Thank you. I hope you guys have a blessed and beautiful week this week. And I hope nothing but good things come your way. So thank you so much. And I'll be seeing you guys soon. And have a great evening. You guys have been very helpful to me as well. Thank you, Juliet. Thank you, everyone else. And good night.